I'm Dr. David Barold, and on this channel we cover ECG basics and how to avoid common diagnostic ECG errors. In this video, which is the final part of this series on heart block, we will go over several ECG practice strips to test your acquired knowledge from part 1 and part 2. We will show each ECG for a few seconds before providing the answer. Let's get to it. Here is ECG number 1. What type of heart block is present? There is sinus rhythm with third-degree AV block or complete heart block. The P waves are marching through the QRS complexes, and there is no relationship between the P waves and the QRS complexes. The atrial rate shown with the blue arrows on the top is 70 beats per minute and is faster than the ventricular rate shown with the red arrows on the bottom, which is 35 beats per minute. The key here is that the atrial rate is faster than the ventricular rate. Some of the P waves are hidden in the QRS complexes or T waves. The QRS complexes are narrow, indicating that the ventricular rhythm originates in the AV junction. ECG number 2. What type of heart block is present? There is sinus rhythm with Mobitz type 2 second-degree AV block. There is a single blocked P wave, and all of the PR intervals before and after the blocked P wave are constant. There are 2 consecutively conducted beats before the block, 3 Ps to 2 QRSs, and the sinus rate is constant. Here is ECG number 3. What type of heart block is present? There is sinus rhythm with first-degree heart block. The PR intervals in the ECG are prolonged. The PR intervals measure around 0.24 seconds, which is abnormal. The normal PR interval should not exceed 0.21 seconds. How about ECG number 4? What type of heart block is present? There is sinus rhythm with traditional Wenckebach second-degree AV block. There are 2 blocked P waves on this ECG, and there is progressive prolongation of the PR intervals before each of these blocked P waves. Note that there are at least 2 consecutively conducted beats, 3 Ps to 2 QRSs, before each block. Also note that the PR interval of the first conducted beat after each block is the shortest. How about ECG number 5? What type of heart block is present? There is sinus rhythm. The PR intervals before and after the blocked P waves are constant, so at first sight this appears to be Mobitz type 2 second-degree AV block. However, there is evidence of slowing of the sinus rate. The green intervals on top represent the intervals between the P waves. You can see a clear increase in the PP interval before the block. The diagnosis of Mobitz type 2 second-degree AV block cannot be made in the presence of variable slowing of the sinus rate. The heart rate must be constant. This ECG is consistent with increased vagal tone and is relatively benign. Here is ECG number 6. What type of heart block is present? There is sinus rhythm with prolongation of the PR intervals before the blocked P wave. The second PR interval shaded in brown is longer than the first PR interval shaded in blue. However, there appears to be no further change in the PR intervals until the 5th PR interval before the block, which is shaded in orange. This is the atypical form of Wenckebach second-degree AV block in contrast to the traditional form of Wenckebach block. This is because there is unpredictable prolongation of the PR intervals as opposed to progressive prolongation of the PR intervals. Note that there are at least 2 consecutively conducted beats before the block and shortening of the PR interval of the first conducted beat after the block. Remember that the atypical form of Wenckebach block is more common than the traditional form of Wenckebach block. Here is ECG number 7. What type of heart block is present? There is sinus rhythm with advanced second-degree AV block. There are 2 sequentially blocked P waves so that there is a block ratio of 3:1, 3 Ps to 1 QRS. Advanced second-degree AV block cannot be classified as Wenckebach or Mobitz type 2 second-degree AV block. And finally, ECG number 8. What type of heart block is present? On first glance, this appears to be sinus bradycardia with first-degree AV block. But this is actually sinus rhythm with 2:1 second-degree AV block. The blocked P waves are actually hidden inside the T waves, but their presence is revealed by subtle changes in the configuration of the T waves. This is most evident in leads V1 and V2, as shown with the red arrows, and in the lead 2 rhythm strip on the bottom, as shown with the blue arrows. Always look for hidden P waves in an ECG that appears to be simple bradycardia. This cannot be called Wanky block or Mobitz type 2 second degree AV block because there are not at least 2 consecutively conducted beats or 3 Ps to 2 QRSs before the block. It is simply 2-to-1 second degree AV block. This wraps up the last video of this 3-part series. I hope these videos on harp blocks served your learning process. Drop a question or comment below and be sure to subscribe and click the bell icon to be notified of my next video release.